Hello, my name is Christel Gharby, and this semester I worked with Howard Kaplan to design a mouthpiece for quadriplegic patients at the James A. Haley Veterans Hospital. Quadriplegia is defined as the paralysis of all four limbs. It is typically caused by a spinal cord injury, but can also be a result of cerebral palsy or a stroke. A study dealing with the effects of hospitalization on older adults makes some interesting correlations between the duration of a hospital stay and a patient's health. Under psychological risk factors, they mentioned that the hospital setting may exert negative psychological consequences, causing older patients to feel worthless, fearful, or not in control of what is happening to them. And as for social factors, it mentions the importance of social support during hospitalization. And both of these things can be alleviated using an iPad. However, that's slightly challenging for quadriplegic patients since they are unable to use their hands. So this is where my project comes in. These patients spend most of their day in a hospital bed with little to do. They do have an iPad, however, set up in front of them that they can use for entertainment, research, and reaching out to family and friends. Currently, they access this iPad using a rigid mouse stick that they simply insert into their mouth and use to tap on the screen. This is slightly impractical for them because they also use the stick to reach different buttons along the side of their bed, such as ones that adjust their bed height, call their nurse, and also do other functions. The mouse stylus was 3D printed using regular PLA plastic. It was printed in many different pieces, however, these are the three main components. Along the bottom is the inner tube with its several different notches for different settings. There is the outer tube in the middle, and then the clip is along the top. What I have designed is a mouth stick that can be adjusted to different lengths so that the patient can reach objects and buttons at different distances from them. Over here is the mouth stylus that can be held by the patient's mouth on this end, and they can use it in its retracted position for objects up to 20 centimeters away. However, if they would like to extend that, they can simply bite down on this clip over here and blow into this hole on the mouth end, which will cause the inner tube to expand. And then once they release the clip, it will securely go into the nearest notch. And if they would like to retract it, they can simply bite down again, tilt their head back, and it will lock back in its initial position. In the case that the patient bites down and tilts their head forward, this inner tube could potentially fall out. So what I have done is installed stoppers on the inside of this outer tube that will catch it as it falls. This way it does not fall to the ground and the patient can simply bring it back by tilting their head and returning it to its resting position. A few adjustments can be made to improve upon this mouthpiece design. The first would be to reduce its weight as it is slightly heavy to be held for long periods of time by a patient in their mouth. This can potentially be accomplished by reducing the diameter of the outer tube and the inner tube. We could also create a new sliding mechanism for the inner tube as it could potentially twist and keep the clip from locking properly into place. The mouth stylus has gone through many changes since its initial design, and I look forward to keep improving upon it even after the end of this class. My next step would be to add some sort of mouth guard to the end of it so that the patient can more comfortably hold it in their mouth for longer periods of time.